Hello, and welcome back. I'm Dr. Emma. I want you to imagine this moment. You wake up in the morning, you check the calendar, and suddenly, your heart drops. Your period is late. At first, you try to stay calm. You tell yourself, maybe I miscounted. Your body is not a clock. Most of us grew up hearing the same thing. A normal cycle is 28 days. But that idea is misleading. Because in reality, a healthy menstrual cycle can range from 21 to 35 days. And even for the same woman, it doesn't always stay the same. Some months, it's 27 days. Other months, 31. And that's completely normal. Why? Because your cycle is controlled by something incredibly sensitive. A system called the hormonal axis. This is a communication loop between your brain, your ovaries, and your hormones. Your brain sends signals. Your ovaries respond, hormones rise, fall, shift, and eventually your period begins. But here's the important part. This system is fragile, not weak, but responsive. It reacts to everything: your emotions, your environment, your habits, even your thoughts. So when something changes in your life, even slightly, your cycle can change too. And that's where most people misunderstand their bodies. They think, if my period is late, something is wrong. But often, nothing is wrong. Something is simply different. Let me explain. Imagine your body like a conversation. Every day it's speaking to you through your energy, your mood, your sleep, your hunger, and yes, through your cycle. When your period is late, that conversation has changed. Your body is adjusting to something. Maybe stress, maybe fatigue, maybe a shift in your routine. And instead of forcing it back into a perfect schedule, the real question you should ask is, what changed in my life recently? Because your cycle doesn't exist alone. It's connected to everything. And once you understand that, you stop fearing your body and you start listening to it. But then the thoughts start. What if I'm pregnant? What did I do wrong? Is something happening to my body? And in just a few minutes, your mind goes from calm to panic. But here's the truth that most people don't tell you. A late period does not automatically mean pregnancy. In fact, for many women, pregnancy isn't even the reason. Your body is not a machine. It doesn't follow a perfect schedule. It responds, it adapts, it reacts to everything happening in your life. And today, I'm going to explain exactly why your period might be late. Even if you're not pregnant, we'll go deep. We'll talk about hormones, stress, lifestyle, hidden conditions, and most importantly, we'll talk about what your body is trying to tell you. Because this is not just about your period. This is about understanding yourself. Let's begin. The real reasons. Your period is late now. Let's go deeper, because this is where things become real. These are the actual reasons your period might be late, and I want you to pay attention because you might recognize yourself in one of them. 1. Stress, the silent disruptor. This is the most common cause, and also the most underestimated. You might think stress is just emotional, but in your body, stress becomes chemical. When you're stressed, your body releases a hormone called cortisol. And cortisol does something very important. It tells your body, this is not a safe time. So your body shifts into survival mode. And in survival mode, reproduction is not a priority. That means ovulation can be delayed. Hormones become unbalanced. Your period arrives late, or not at all, and stress doesn't have to be extreme. It can be overthinking at night, relationship tension, work pressure, even silent anxiety you don't talk about. Your body feels it, even if you try to ignore it. 2. Weight changes. Your body needs balance. Your body relies on a delicate balance of fat and hormones. If you lose weight quickly, your estrogen levels can drop. And without enough estrogen, your cycle slows down. If you gain weight rapidly, hormonal imbalance can occur. And again, your cycle becomes irregular. This is why extreme dieting or sudden lifestyle changes can delay your period. Your body is trying to stabilize itself. 3. Overexercising, when healthy becomes too much. Exercise is powerful, but too much of it can send the wrong signal to your body. If you're pushing yourself intensely, long workouts, high physical stress, not enough recovery, your body starts to think, we don't have enough energy reserves. And once again, reproduction is paused. This is common in athletes, but also in anyone trying to push limits. Balance matters. 4. Sleep disruption, the hidden factor. Sleep controls your hormones more than you think. If your sleep schedule is irregular, if you stay up late, wake up often, or feel constantly tired, your hormonal rhythm gets confused, and when your hormones are confused, your cycle follows. 5. Birth control and medication. Starting or stopping birth control pills can change your cycle temporarily. Your body needs time to relearn how to regulate itself. Other medications can also affect hormones, so if your period is late after a change in medication, that may be the reason. 6. Hormonal conditions. Sometimes your body needs more attention. Conditions like polycystic ovary syndrome, PCOS, thyroid imbalances. These affect how your hormones function, and when hormones are not stable, your cycle becomes unpredictable. This doesn't mean something is broken. It means your body needs support. 7. Travel and life changes. Even something simple like traveling, changing time zones, or shifting your daily routine can delay your period because your internal clock, your biological rhythm, when you should pay attention. Now let's talk about something important, because yes, sometimes you do need to take action. A late period once in a while, normal. But if you notice patterns, you should listen. Here are signs you shouldn't ignore. Your period is missing for more than 2 to 3 months. Your cycles are constantly irregular. You feel unusual pain or symptoms. You notice changes in your body that concern you. And of course, if there's any possibility of pregnancy, take a test, not out of fear, but for clarity. What you can do instead of panicking. Focus on restoring balance, manage your stress, improve your sleep. Eat consistently and healthily. Avoid extreme changes. Track your cycle because awareness changes everything. Your body is not against you. It's communicating with you. A late period is not always a problem. Sometimes it's a message, a signal to slow down, to pay attention, to reconnect with yourself. And once you understand that, fear disappears and trust begins. If this video helped you, subscribe for more real, honest conversations about women's health. I'm Dr. Emma, and I'll see you in the next video. Needs time to adjust.